Hello viewers, and welcome again to our favorite family program right here on Ekwa TV, The Living Room. My name is Amaka Ocheke, and this evening I have some wonderful ladies with us to discuss something very serious about our children, but we'll get to that later. So right here with me is a very hardworking lady, Dr. Gyang. She's a psychiatrist in youth and very interested in making mental health issues on the top burner, to put it on the top burner so that people are aware of how mental health affects us. And of course, one of our usual people, Mrs. IB Namo.
Good evening, viewers.
Who is an educationist and has been giving us a lot of information about our education of our children, how to raise our children in past issues. So this evening we'll be talking about psychological and mental health issues of children and how it affects their learning and their behavior in the home and in school especially. So we'll just start with Dr. Gyang. When we're talking about mental health issues, psychological issues, do children have those kind of things? Because it seems like it's an adult thing, and when you're saying psychological issues in children, say, what do they even know that they're having psychological issues? So do children have this kind of problems?
Okay, thank you very much for having me on your program. Yes, indeed, children have psychological issues, children have mental health issues, children can develop mental illnesses. And in fact, research has shown that over 70% of the mental health issues that you see in adults actually began during childhood. Oh. It's just that they were not really identified and managed at that time, and that's why you see them presenting in children. So, yes.
Okay, still on that. So, since this, you've said that 70% of mental health issues start in childhood. Yeah. What are we looking at? What kind of things we'll be looking at to give us an idea that these children may have some mental health issues?
Okay. So I'm sure you're looking at things to look out for in children.
Or what you would notice that would suggest, and not just that this child is stubborn, this child is misbehaving, you know, the way we carry on. What would you see and you say, okay, this child would need help?
Yes, generally mental health issues affect the thoughts, the feeling and the behavior of people, including children. So the interesting thing about children is that the manifestation of mental health issues is not as straightforward. It does not manifest as you see in adults, primarily because children are growing. So a lot of times we see some of these symptoms and think that they are a part of their development. Their growth comes with changes. So for every stage of childhood, you discover that there is some change in the personality, in the way the child presents himself. And so a lot of times we might think that they are just normal changes happening, and then again they are unable to communicate. So most of the communicate expressively what they are passing through. So it might be difficult. But some of the things that you can watch out for would include a child that was any change in behavior of the child. You know, a child that was formerly very boisterous, very talkative, suddenly becoming quiet and withdrawn. It might be a sign that a mental health issue is developing. A child who was probably had developed has achieved some milestones in life. For example, a child that has achieved continence, that means that the child has stopped bedwetting. Then suddenly the child starts bedwetting again. Or the child has achieved the age in which they should achieve continence, that's to stop bedwetting, and then they are unable to stop bedwetting. It might be a sign that there is a mental health problem. Sometimes some aggression in children might just be a sign that they need help. You know, those struggling from mental health issues can also become bullies, especially in a child that has not been a bully before, or even an increase in or the child himself being bullied. You know, sometimes mental health problems can affect the child's interaction or makes the child to begin to behave weirdly in class and things like that. So other children would bully them. Then when you start having children acting out, so some of them will become very stubborn, some of them will become very deviant, they don't listen to rules, they just do the opposite of what they are being told. Some of them can even begin to act out explicitly mostly sexual activities with their mates or even on themselves, they might be those might be some signs. Also, children might have sleeping issues, you know, and then there could be a change. When children have sleeping issues, it might go both ways. So some children, when they're having mental health issues, they're sleeping excessively, while some other children are finding it difficult to sleep. Sometimes even the increase in nightmares in children might be a sign that mental health issues are developing. Then change in eating pattern can be a sign. Some children, when they're mentally ill, they eat a lot, some would not eat. Then you can have, for most especially for girls reaching adolescent age, you know, they can begin to become obsessed with their weight, their shape, and things like that, and as a result, they avoid food, or they go through extreme measures, taking a lot of lemon, taking Lipton and stuff like that to keep their shape. Yeah, so it might be a sign that something is happening. Then sometimes you can see children who are going through mental health challenges beginning to either draw weird stuff, you know, or draw violent images, you know, on paper and things like that. It might be a sign that something is going wrong. Then a lot of the times, especially in adolescents, they use new or recent usage of psychoactive substances, whether it's alcohol, marijuana, whatever it is, might actually be a means to cope with their psychological distress. You know, so those are some of the things that you watch out for. Then, sorry, I forgot this very important one, a decline in academic performance. You know, a child who was used to being in the top of the class suddenly, for unexplainable reasons, the academic performance begins to drop. And I think for our adolescents and young adults, even though we're talking about children, those that are in the university level, oftentimes that is the first manifestation of mental illness in them. You just notice a decline in academic performance. Then anxiety, they are always tense, they are always anxious. And sometimes when it happens in very little children, because even babies can have mental health issues, you know, a child who was okay with the parents leaving home suddenly becomes very clingy, become scared or terrified of the parents leaving them. You know, it might be a sign that a mental illness might be on the way.
This is very interesting because you have raised many issues for which we beat and punish our children. And I remember on previous episodes we've talked about not punishing children for things like bedwetting, for things like poor performance in school. We must find out what the issues are before we start acting out, even us as parents. So Mrs. Namo, you've worked a lot with children. Now, let's come from the school's point of view. Okay, we can look at the school point of view and also the parents' point of view. You see that a child is beginning to manifest some of these things. What are you supposed to do?
Well, as parents, like we said, we should be very close to our children so that if we notice anything that is not the usual, we should begin to, even if we don't have the knowledge of what is happening, we should begin to ask questions, look for help. My child used to do well. Now I don't understand what is going on. You might get somebody, one or two persons that will help you. And then if it is school, I have proposed that schools should train their teachers in issues of mental health and psychological issues, because there are even some learning disability among children that people have not captured, and the child is struggling with a particular learning disability and we don't know that he has that learning disability. Like I was discussing one with you, a child is diagraphic and nobody knew, and the child, whenever they ask him to copy notes, he will start crying, they said, you are stubborn, you are lazy, what? They started banging and beating the child, only for them to discover that the child has dysgraphia. By the time they discovered, they now started working on the child and discovered that the child can use more of computer to write, you know, and then there are other measures with which if you introduce to the child can write better. So if you notice anything, whether as a school or as parents, the first thing is to sit the child down and try to find out what's going on. And then you can now begin to look for help. How do I help this child so that the child will do well in school? Because we are marrying you to school now. So let's look for help.
So, Dr. Gyang, where can we get help? Because while you're telling us about getting help, I also want you to address spiritual, in quotes, issues. Because when children have problems, I think the easiest help parents want to get is like a spiritual attack. So we go for deliverance and prayer. I have a friend who had a child that was autistic. She said for many years she didn't know what was wrong with her child. The teachers told her child was possessed. She should go for deliverance. And they went, but nothing was working. Then she stumbled on some material and read it. And she's the one who made diagnosis that her child had autism. She read it and she said the thing just, everything fell into place, that this was her child. And she now started seeking for specific help for autism. So what do we do when, I know in this environment, every small problem, yeah, we should pray, I agree, but is everything demonic possession? Is everything deliverance? So sorry, I'm putting a heavy weight on you, but I think some of these things we need to speak to ourselves and help. So where do we get help? What do we do about the issue of that the child is possessed?
Well, help is available for every child that is going through psychological issues. I think the first thing is to be able to diagnose what the problem is. I know that there are school psychologists, there are clinical psychologists, and there are psychiatrists ready to help. I know of a few schools that when a child is given, when they notice particular issues, they either invite a psychiatrist or a psychologist to come and just assess the child and then see if they understand what is going on. I think it is when you understand what is going on, then you would know what kind of help to get for the child. Sometimes what children would need is medication. Sometimes it's just psychotherapy. That is talk therapy, where you try to help the child. And you know, you wouldn't do talk therapy the same way you do it with adults and children. Most of it comes through play, you know, and things like that. But there are specialists who do that. So I think if your child is going through stuff like that, just take the child to the hospital. Even if you don't get access to a psychiatrist immediately, you get a family physician or any doctor that knows what they are doing. They should be able to help and then direct you to the right place to go. Now, concerning spirituality, I personally believe that yes, a lot of things that we see in this world begin in this. In fact, the presence of illness itself is because it started from a spiritual dimension. Man fell and there was separation, and therefore we have to live with the consequences. So everything is spiritual. Malaria is spiritual, typhoid is spiritual, so everything is spiritual. Now, that being said, I think one of the problems we are having as Christians is that we are not remembering the fact that we exist spirit, soul, and body. And these three dimensions of us, you know, exist in unity. If your body is not functioning properly, there is a way it affects the soul and the spirit. And so a lot of times we just focus on the spirit and then forget exactly, you know, things that God has made plain to us. God is the giver of science. God is the giver of knowledge. The drugs that he has not permitted us to discover, we have not yet discovered them. And I think if we look through the Bible, there are a lot of things that happened that gives very strong support to medicine. For example, I remember the story of Hezekiah in the Bible. You know, when God told him he was going to die, and then the prophet was sent to him and he pleaded and everything. God told him through the prophet that he was going to live for another 15 years. But he didn't start recovering until they did what God directed. He said they should make cake of figs and then place it on the wound. I believe that God had the power. He had already said he was going to leave. So why didn't he just jump up and go? They didn't particularly, I didn't think God needed that. But I think it was to leave for us an example that sometimes even when things are settled in the spiritual, we have to do what God has shown us to do. I think that's where Christians are lacking. I think we need to disabuse our minds from the fact that taking medication is not an act of faith. A lot of times our children suffer, and you know, the issue about mental health issues is that when you don't treat it early, especially in children, their brains are developing. These things happen at the level of the brain because every behavior, every thought, every feeling comes about as a result of neurochemicals. There's some chemicals in our brains that are responsible for the way we think, feel, and behave. So sometimes there can be an imbalance in this, and then it affects us in various ways. Sometimes because of some deficiency or defect in development of certain areas of the brain that produces this chemical, you find these issues. Now, if you go and keep praying and not seek the help, it's just permit me to use the word foolish as you having malaria or typhoid and praying and refusing to take anti-malarial. It might eventually kill you. Or you having a cancer and refusing treatment, for example, it will eventually kill you. So I think we need to look at it as Christians that first of all, yes, when we have issues, we should pray about it. But when we pray, I think the prayer is, God, do this and direct me on where to go. So that I can seek help. Everywhere in the Bible, people sought help. Even in areas that Jesus could do things, he did a lot of things. I think that we're just to leave for us an example, like using mud on the eyes of the blind, you know, and things like that. So yes, we should pray, but immediately after you say amen, stand up and seek help. Yeah.
Okay, now seeking help. I remember you said that in certain schools, that they call psychiatrists, psychologists to come and assess it. Okay, what if your child, for parents out there who maybe their children attend schools where you don't have that kind of access to say, what do they do? What can they?
Please take your child to the hospital. These things are, you know, the cost sometimes of all the deliverance that you do is actually cheaper than taking the child to a tertiary center like Jude. Jude is in fact, an extremely cheap hospital. Sometimes we go from pillar to post, travel everywhere, get whatever it is, you know, get anointing oils, drink them, holy waters. We buy these things. Meanwhile, the amount that you use for all those things can be used for treatment and things like that. Treating mental health challenges is not particularly expensive. Maybe when you have things like attention deficit hyperactivity disorder, yes, it might be a little bit expensive, but a lot of the medications are actually very cheap. So if you don't know where to go to, I can guarantee you, take your child to Youth. Take your child to Bingham University Teaching Hospital. I know there is a psychiatrist there. Take your child to Plateau Hospital, and I assure you some help is, yes.
Okay. I know that the other challenge parents have is this mental health label. So my child is mad. So my child is psychiatrist. Once you say, because even sometimes when I refer patients to psychiatric clinic, they're like, are you saying I'm mad? I start trying to explain to them. So, Mrs. Namo, maybe I'll get to you because Dr. Yang is a doctor. So this psychiatrist something doesn't mean anything to her. As a parent now, and talking to other parents, what would you? How would you advise them to look at these mental health issues? Is their child mad? Is their child forever labeled to say, okay, this one? And then some people are thinking, if people hear that my children are like this, they will not marry, people will laugh at our family, and all that and all that. So you now, as let's look at it from a quote normal parent point of view, because Yang is a psychiatric parent, so she may not understand what normal parents are going through. So normal parent, tell us.
Well,
what do
maybe
you think?
because I also I'm also into psychology.
You're not
so,
a normal parent.
So I don't know whether I'm a normal parent, but then I know that I've done a lot of training for teachers and parents, and I've told them that, see, when they say your child has a mental challenge, your child is not a weary. It's not mad. It's just that something is not right. Something is not the way it should be in your child and needs correction. Like Dr. Yang says, some of these things, they even need just talk therapy and maybe an educational, a different educational approach. There are some children that there's a particular educational approach that fits them because of their mental state.
Challenge. Okay.
And if you don't know that they have that mental state, if you have not known, you will join them with other children, and they cannot cope with other children. So you will now remove them and call them stubborn, labeled. Which one is better for you to say that a child is having a mental health, or that the child is stubborn, is useless, he can never amount to anything? They tell children all of these things, and these children, the truth is that it's not like they cannot amount. Some of them are very intelligent, but this mental issue is the one that is withholding them, and because the school have not been able to draft a program that will meet their states. So parents, please, your child has a mental health. It's not that your child is mad. It's like is that something is not particularly correct. So we need to correct it. If you go to the hospital, sometimes it might not even be that you have to be on drugs. Okay, we believe more in talk therapy in psychology. So sometimes it's more of just talk and a little introduction to these things. Sometimes these children at a particular age, if they are properly managed, they outgrow it. But if you leave them, the thing continues to degenerate. And when they become adults, it becomes even worse than what it is before. So parents, your child is not a mad person, but he has a mental challenge and it needs to be dealt with. So if you notice it, seek for help, please.
So why I'm raising this issue so that parents understand that when children are having challenges, maybe sometimes behavioral challenges at home or academic challenges in school, it's not always because the child is stubborn or the child is just a difficult child or you don't know where this child is coming from. You know, you start beating the child, calling the child names, and all this you're beating and calling names is not changing anything. Sometimes it's good to sit back and ask questions and check that child very well. The child may need help. You too, as a parent, may need help to help that child to be the best that the child can be. And as we have heard, there's hope and there's help available out there, but we must be willing to take the step to take the help. And I don't think we should label ourselves or discriminate against ourselves and say, oh, they say psychiatry, psychia. Okay, that's how they say, you're sending me to psychia, so I'm not going. Please don't do that to yourself. Let's solve problems early so that these children can be the best that God wants them to be. Okay, back to you, Dr. Gyang. What are the things that could cause some of these mental health issues? Are they born with it, or is it something the parents have done that is causing these children? Because if there's something that they can prevent, let's hear it so that...
you know, the interesting thing about mental health issues is that a lot of times you would not be able to say this is the one cause, but it's an interaction of so many factors. And some of it would include genetics, you know, so that means that it can be inherited. And again, mental health issues, they have the tendency to skip generations. So sometimes people think they don't have a family history of mental illness, so why is this thing happening now? But it might have existed in some great-great-grandparents that you are not aware of, and so it manifests in the child. Then the other very important cause is neurodevelopmental issues. So I'm sure we all know that when a woman is pregnant, they would always say, go for your antenatal, you know, visits and things like that. That is because the brain cells are laid down very early, within the first few weeks of development of pregnancy. Almost all the brain cells, in fact, all the brain cells are laid. It's just that they just keep developing and expanding. So anything that will affect that process, including things like illnesses, fever, whatever it is in a woman while she is pregnant, can actually set up her child for development of mental health issues later on. Yes, and even the drugs that people take, or the drugs that they refuse to take, you know, like folic acid, you know, so it can cause that. Then the issue of the use of alcohol during pregnancy. In fact, that is one of the greatest cause of mental retardation in children. So, you know, that can really affect brain development.
So, now, mommies, don't drink when you're pregnant.
No, including big stouts.
Big stout, they say it's ECWA approved. It's not ECWA approved. I'm very aware that ECWA didn't approve stout or anything for anything.
And then if you're looking for blood, maybe you should go to other sources, because there are other things that can can improve your blood other than that. Then you now have you know, difficult labor, difficult childbirth, all those propagandas of Hebrew women theory.
That's another thing. You want to deliver like Hebrew women. You don't want to come to hospital. You want to deliver at
You don't want to accept CS.
And then you set your child up for developmental problems.
Illness later.
It's you that is causing it, it's not devil.
Yeah.
So,
malnutrition.
Yes. Then as you give birth to the child, you know, there is what they call maternal bonding and attachment. Now, that happens, that is solely dependent on the psychological state of the woman herself.
Yes.
Now, the interesting thing about mental health issues is that over 50% of women that give birth go through maternal blues, and 50% of them will develop postpartum depression.
wow.
Less than 10% of them will get treatment. Now, 90% of women that develop postpartum depression would just suffer it in silence, probably until it lifts. But the problem is that it is affecting your child.
Wow.
There will be inadequate bonding and attachment between you and the child. So that can lead the child, because studies have shown that women that have postpartum depression, they are not treated or don't get adequate help, what happens is that their children actually develop at a slower rate than the children of mothers that don't have postpartum depression. So if you have psychological illness yourself and you're refusing to get treatment, you're actually setting up your child up
for problems later
in life. Then she mentioned malnutrition. Yes, in fact, starts from breastfeeding, because breastfeeding is another way of bonding with your child. So every woman should breastfeed, except if there are medical indications for that. Now, that's for not breastfeeding. Then malnutrition is there. And then the next thing is that when children are bullied, either by their parents, by their siblings, or by other peers, they are most likely to also come down with mental health issues. Then another thing that we don't pay attention to, you know, a lot of us parents, it's easy for us to shout, my child is being bullied, and we fight and whatever. But then when children watch violence, especially between parents, it sets them up for developing mental health issues. So if you and your husband are always quarreling and fighting and violent on each other, you're not only destroying yourselves, but you're destroying your children even more, and they are more likely to have that. Then the issue of abuse, physical, mental, verbal, you know, a lot of us, we don't do the physical whatever, but our mouths, the kind of things we say, you know, it sets up the children for that. Then the issue of sexual abuse, you know, sexual abuse is something that we should not be hiding. A lot of times, because of the fact that it has been said that over 70% of people that abuse children are actually family members, and because of that, we tend to just sweep it under the carpet, we pray about it, and we allow it to
We don't want family trouble.
But yes, but a lot of, in fact, one of the things that I have noticed in adolescent children who are unable to stop bedwetting, if you check properly, they have either been raped or someone has been molesting them. You know, and it causes that. So abuse is also a factor. Then when we also place a lot of expectations on the children that they are unable to meet, it's also a risk factor. You know, these days, I think parents, we are competing with each other, you know. My child is going to JS1 at age 9, 10, so you know, that kind of thing. The person is not yet mature enough to handle. He might be intelligent, you know, but the emotional intelligence, you know, it's not there.
But even this intelligence, you know, when parents are just a child, I've realized that there's nothing special about the intelligence. It's just parents, children just do averagely well. They're just okay. You just be pushing them, pushing them. They say they're I'm like, what have they done that you are calling them so intelligent? You won't allow them develop at their own rate. You are putting pressure on them.
Some schools
you give children double promotion. For what now?
Double promotion.
Oh, the child cannot even play because from school he comes back home, there is lesson teacher waiting. You know, long vacation, lesson teachers, you know, all these things.
You keep a child that is in nursery school and he's doing lesson after school. What kind of lesson is he doing?
To learn how to hold pen.
The one he is learning in school
No,
is
it's not
what?
enough.
In
They are
fact,
doing lesson to hold pen.
Research has
For
actually
2-year-olds.
shown that there is no significant difference in children that start school from the age of, from 2 to 5 years and those that start from 6 and above. They all level out later on.
Later.
So everything that we are doing before the age of 6, we are
It's
actually
waste.
wasting. We are helping ourselves because we don't have time. Not really the children. Yes. Then the issue of what do you call it now? When children are exposed to what is happening in our society now, we have violence everywhere. Kidnappers are kidnapping children. They are kidnapping their parents in front of them. We are having crisis. Recently, I have a young man who watched his father killed at the age of 10 or 11. I've also seen a 10-year-old that watched all his family members except his father, who was not in the house. That's from the grandparents to the mother, the uncle, and all his siblings. He actually watched them die. So we are beginning to see children who have experienced this kind of thing, a lot. Then another very important thing is that when children don't have social connectedness, and this is a problem for us, in this generation of parenting. Children don't play, children don't go out of their houses, we are locking them, we are locking them up. And then interestingly, even when their friends visit, they are watching TV. They don't talk to one another. So what we are having now is we are having a generation of adolescents that are unable to talk to one another, that don't have the ability to even listen to one another.
No social
skills.
skills.
So we now push them at the age of 15, 16, they are in the university.
Wow.
They cannot talk to one another. So they go, and probably we have been pampering them all their life, and they now get to the university, and suddenly one lecturer does something they don't like and they become suicidal, So that is also a very serious factor. So, and then the other issue is social media. We expose our children to social media these days so early that they are forming like their self-image from what they see, from what they read. And those things have actually, apart from eroding communication and interaction, it has also put so much pressure. And then these days we deal a lot with cyberbullying. So everybody wants to put up their pictures on social media, and somebody is saying, look at you. Some people just, especially girls, very little things like look at your nose would make her to obsess about the nose, to think about how to change it. If she does not, she gets depressed, and certain things can just follow through. Then the issue of use of psychoactive substances too, especially in children, the worst form of mental illness, schizophrenia, has been linked to cannabis use. And these days,
cannabis is Igbo,
yes.
Igbo Indian hemp.
Yes, Indian
Yeah, you
hemp.
not say this one is not in Nigeria, something like a Western name. It's Igbo Indian hemp.
Yeah. So, and then these days we see that, you see children, you see young adults or adolescents who are into substance use. You ask them when did they start the use of psychoactive substance, and they will tell you at age 9, 10.
Who gives
in
them?
JS1. Yes, that's how bad it is.
They find a way of getting it.
That's how bad it is. Children are the thing is that it's a combination of so many factors. When a child is growing, reaching puberty, adolescence, by nature, the way God designed them is they are very restless. Then we lock them up with TV. They get bored. And then we have left them with phones, Android. They start going online and finding things. And these days, you can find how to do everything online, including how to smoke, how to kill yourself, how to do whatever it is. And so they get exposed to these ideas very early, and sometimes even the things that we watch ourselves is exposing our children. Research has shown that young children and adolescents that watch TV content or any kind of media, TV, novels, magazines that promote the use of alcohol are 5 times more likely to use alcohol themselves than those who do not. Cigarettes is 7 times more likely to use cigarettes themselves. Violence, the same thing. You watch violent cartoons, whatever it is, they are more likely to be aggressive. So it's just a mixture of
There's
so
trouble
many
in
things.
the land, though. Okay, viewers, we'll go on break. When we come back, we'll continue this heavy discussion. Many things, so we need God's help. We need God's help to help our children. So we'll go on break, and then when we come back, we'll continue the discussion. But if you have any comments, you can post on our Facebook page, and we'll look at it. I will comment. We'll respond to your comments. We'll not have phone lines open today. We'll still have some issues with that, but you can post your comment on our Facebook page, and we'll get back to you. So see you again shortly after the break. Welcome back, viewers, from our break. We've been here discussing psychological issues, how to deal with psychological issues in our children. And I've been here talking with Dr. Gyang here and Mrs. Namo, discussing very strong issues. And when we went on break, I was just asking, the issues are heavy. What do we do? And then just to let us know, remind us again, we could post our comments on our Facebook page. Bright, we just saw your comment. Thank you for watching. Keep watching and keep posting your comments. So if you have any comments, any questions, please post on our Facebook page, and we'll get to your comments later. So, many things we need to do, many things that could predispose to mental health issues in our children. I don't even know where we will start. I don't even know where we start, but okay, before we start talking about how we solve the problems, in school, teacher, mental health, psychological challenge, how do children manifest in school? Because Dr. Gyang has told us one thing, that sometimes academic work suffers. What are the other things you see as a teacher in school?
A lot of children with mental health are very restless in class. They are the bullies most of the time. They make a lot of noise. They distract. They want to distract the class. And some of them, they never do their assignment on time. Their notes are always usually scattered. You will see their notes are not complete most of the time. You will see them, their eating habit is also a problem, even in school. When others are eating, they either not eat, or they go to school with their food and come back home with it. And the parent will say, my child didn't eat the food, I don't know what to do, and things like that. So there are several other issues. You see them in school. They are always, some of them are very withdrawn in class. They don't talk to anybody. They don't make friends. They sit at the back, and when you ask questions, they never answer any question. Even if you point at them, they will just shake their head. They don't want to be part of anything in class. And some, they are the ones that are answering all the questions in class. Before you ask any question, excuse me, ma, excuse me, ma. In fact, if any other person answers, he will want to still tell you that he still has an answer to give. So you will think that he's very intelligent. Actually, he's struggling. He has a problem. He cannot sit still. I remember some of them, we used to teachers used to tie them to their chair, and if you tie them to the chair, then they will rock the chair to make noise. The chair will still tell you that the child is still in class. You know, you are teaching in the board, somebody will wrap something and stone you and pretend, and you will not know who has done it. And you know, so these are some of the manifestations.
Just disruptive behavior.
They are very disruptive, and it's not like some of them. It's not like they really want to do what they're doing. It's because there is a challenge that needs to should be dealt with. And if those challenges are not dealt with, most times we take wrong approach
Actions.
to deal with it. We beat them, like I said, we tie them to the chair, we give them punishment, tell them to pick pin. He will pick, while he is picking the pin, he will leave the pin he is picking and go and pinch somebody and come back and continue to pick the pin. So when the child reports that, John pinched me, you say, which John? John that is picking pin there. It's true, John has gone to pinch somebody and went back to pick pin. So it's not about punishment, it's about if you see a child that's very restless, a child that is always seeking attention, we need to give that child attention to find out what is really going on. How do we help this child? And most of these children are inside our classes. You know, it's only very few of them that are in special school, like maybe the autistic one, the Down syndrome.
That they've even made diagnosis of, because there are some you have not
diagnosis.
made diagnosis.
Yes, those ones are the ones in special school. But a lot of other children that are not, they are in the mainstream school, but they have not been mainstreamed inside the school because they are different from every other child, and yet they are forced to do the things that every other child is doing.
And also in church, Sunday school, you also see them.
You will see them there in Sunday school.
Acting
out. They will always act out. Something is either they are very, like the ADHA that I'm working on, there are two types, the active one and the quiet one. The quiet ones will sit and they will not talk. They are easily distracted. You are talking to him, you think he is looking at you and he's hearing,
mind has wandered.
He is gone. When you now say, what did I say, Gabriel? You say, Ma? Yeah, it was not there. You were just talking. So, those are some of the signs you will see, and you will know that there's a problem.
Why I deliberately got you to say all these things is that in the past we've talked about parents making sure that when you get your children's report card, you must look. It's not just did he come first, did he come second. All the other comments the teacher is making about the child's behavior, you should also look at it. And I think you even mentioned it that day, that they should make time to come and discuss with the teacher the things that they have seen about the child's behavior. And also to encourage parents, please, when it is open day, go to the school. I don't know what is so important that you neglect the opportunities to discuss with your child's teachers about how your child is doing in school, because it's during those discussions that you'll be able to pick up some of those things that the teachers have been noticing, and then you know that you need to do something about it. And even outside parent open day, I think parents make effort to discuss with your children's teachers.
Make friends with
talk with them, find out how your child is doing. And even in Sunday school too, in church, talk with your children's Sunday school teachers. I don't know how all you do is drop your children in Sunday school. You never ask the teacher, please, how is my child doing? Is he learning? And then when the children come home, you also ask them what they learned. And you find out whether they are participating or not. All these things, I think, would help as pointers to show that our children may have a challenge that we need to work on and to sort it out. Not just stopping to say, stubborn children, beat him, shout on him, or verbal bullying that Dr. Gian Grace will now wash them down and tell them, as they say, ancient and modern. You give it to them, woto, as they say. You give them. Then the child will cry and even become further, depressed and all that. So, Dr. Gian, you raised many things that emanate from us, the home. So, what can we do? Because the things are plenty. Where do we start? Where do we start?
I think parents should start on themselves first, because as I said earlier on, the psychological development of your child depend on you, the parents, and then the environment that you have created for your children. And that would mean that we pay careful attention to ourselves. I think when the Bible talks, whenever they are doing church dedication, and they are saying, parents, remove from yourself everything that can hinder this child. We always think about just the spiritual issues, but then you can actually hinder the child's progress mentally, psychologically, and things like that. So I think first of all, our homes need to be peaceful. A chaotic home will always produce a chaotic child. So we need to live in peace with each other as husbands and wives. And the interesting thing is that babies actually pick the mood of the parents. So even when you're not physically fighting, you're not physically or you're not verbally exchanging words, but there is this passive aggression between you. Even little babies less than 1 year old, they are able to pick the fact that there is tension, and it affects them psychologically. So we really need to work at maintaining peace in our homes.
I just to pause for you to pause there. I know people say that it doesn't matter, you know, that they are fighting at home, that the children will learn. They will learn, they will get over it, you know. So do children really get over family problems?
I actually don't think so. Well, there might be some children that will be able to manageably cope with it through life because people are different. But then a vast majority of them have issues. And a lot of the drug abuse that, in fact, I went to a church to speak during their Sunday school week to the teenagers. And I was asking them, we were interacting, why do they think the use of alcohol and other drugs is on the increase in them? And a boy stood up and said, because of stress and pressure. Then he said something, he said, our parents can be very, 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 very annoying.
Wow.
You know, he said that. And it got me thinking. Sometimes we think that our children are just being stubborn. But a lot of the psychoactive substance use that we see is from children not being able to deal with what is happening with the parents.
Yes.
And they cannot come out to talk to their parents. They are already afraid of the parents, but they are feeling pained. So they look for how to cope, and then they start using these psychoactive substances. Then we start blaming the devil. You know, so that is there. Then,
so Dr. Young, I'm going to pause you there because I'm looking at the clock, and I've seen that there's no way we're going to finish discussing the things parents need to do about themselves today. So it's like we're going to have to talk about this thing next week. But since before there's a very nice lady there who will soon start giving us signs to close and go. Before she comes up with the sign, I would want you, so that one, we'll continue the discussion next week, please. But I just want you to talk about suicide, because she raised, Mrs. Namo raised the issue of suicide last week, and that's what got me thinking about talking about this. When children are suicidal, what should be done in the home and in school? Because I've known children who have attempted suicide in school, and the response of the school is to punish the child and suspend the child.
Yeah, we shouldn't joke with suicidal attempts. In fact, any form of self-harming behavior. You know, just before I came today, and someone called me, a doctor actually, and she was telling me about a young lady who was that she had attempted suicide 3 times, and so they don't think that she actually wants to kill herself. That she might just be seeking for attention. I
had a patient last week too, a young lady that came to the clinic for something else, but I started talking with her. She told me she has attempted suicide twice, and I asked her how. She said she used sniper. I said, who bought sniper? She said, there was sniper in the house. She took. I said, what happened? God saved her. She said she knows she died, but as she was going there, she saw a light, and that somebody came out of the light and said, where are you going? Come back. And that's how she came. I said, did you tell your parents? She said, no. But why did you do it? Parental problems. Problems that her parents, her mother especially, was on her case, and she felt killing herself will solve the problem. And I'm just raising this to say this suicide thing is not a joke.
It's not a joke.
Really
so even when children do things like just cutting themselves with even a blunt knife or a blunt razor, it's something that we should that should make us maybe not to raise alarm, because sometimes when we are so dramatic about it, we further push the children to be quiet and not to talk next time they feel suicidal. So, but it should push us to calmly seek for help, you know, about it. Now, when children attempt suicide, a lot of times it is because, in fact, in children and in adults, over 90% of those that kill themselves have a mental health issue. It's not an attack, it's a mental health issue. And in over 90% of them, it is depression. So over 8 out of every 10 people that will attempt to kill themselves, they are having depression. And depression is treatable. So that means that suicidal behaviors are actually treatable things that, you know, children can be helped out of. Now, sometimes the things we say to children, you know, the things, when they have attempted, you know, you want to disgrace me, you want to, and a lot of parents have this whole way of making it about themselves. Exactly. If your child attempts suicide, it's no longer about you, it's about the child. There is nothing like you want to disgrace me, you want to do this, you want to do this. You're not the one that attempted.
You are the least problem at that point in time.
Yes. So it should be about the child. And how should we approach it? Calmly, nicely. Let's not make them feel as if, you know, these are things that can happen with anybody, actually, even for you, an adult. You just need to be sufficiently depressed. You can reach a point that you would kill yourself. I have seen pastors kill themselves. I have seen very spiritual people kill themselves. So it's not about the fact that it cannot happen. So it is something has gone wrong. Now, you are not the best person to help your child if your child is suicidal. Even for me as a psychiatrist, if my child gets suicidal, I am not the best person to help the child. I should get help for my child wherever. In fact, best place is hospital. Of course, if you're a spiritual person, you want to pray first. But immediately you finish praying, please get the child
to the hospital.
Then when you get the help and you have come back home, avoid raising it at every, you know, parents will say, that is the way
she wanted to kill herself,
and then she now went and killed herself.
So we can't talk in this house.
You know, people do all sorts of things like that, which is really not helpful, because you keep stigmatizing the child and relegating the child to the background, and that is not really very helpful. And we should normalize talking about mental health issues, even in the family. It is okay that a person can develop a mental health problem that is not his fault or the fault of, it's not anything that they have done. So we should normalize talking about this thing. Let's teach our children, you know, these things early. I am a very strong promoter or campaigner of, in our Sunday school classes, we should have special times that we teach children about drug abuse, because when children abuse psychoactive substances, they are more than 10 times more likely to kill themselves than those that do not do that, because drug abuse makes them very impulsive. So we should teach children from time to time drug abuse, mental health issues, suicide, and what to do, you know, to prevent
and not avoiding the conversations, like not wanting to talk about the elephant in the room. It's there, but you want to pretend it's not there. Okay, Mrs. Namo, because somebody's already giving us warning signs. Schools, what should they do?
Please,
what should
I want
they do?
To beg you.
A child is suicidal.
A child is suicidal. Please, when you call in the parent, you should seek help. It's not time to expel a child or suspend a child, because you are suspending him to go and die, or you are expelling him to go and die.
So school is not about you.
Yes,
it's about the child.
It's about the child. And please, teachers too, the kinds of statements you make to some children. Children are coming from different homes. You don't know what a child is coming with to a school. He needs, so maybe he's the type that needs somebody to show him love, and then you just make careless statement. A teacher told a child in class, when the child said, he told the child to buy an exercise book, and the child said, I don't have money. He said, hey, your parent that can pay 300 and something thousand for school fees, is it ordinary for 500 naira for a book they cannot afford? And the child took it personal. The child went and was telling the parents, can you see what, you know, such statements can make a child to begin to think, because you don't even know the mental state of the child. So teachers
don't even know what is going on
such
in their lives.
In their lives, yes.
Yeah. Okay, last words, Dr. Gyang, because we are bringing you next week. You have to come and tell us what to do as parents.
So I think what I would want to say is that mental health issues are very common. Mental health issues, yes, they are as spiritual as every other thing is spiritual, but don't hyper spiritualize it. Help is available for mental health issues. Let's normalize the mental health conversation in our homes, in our churches, in our schools. And when we discover any person, any child with a mental health issue, let's know that help is available. So let's seek it.
Okay. Thank you very much. Mrs. Namu. Okay, we'll continue next week. So we've raised these issues, parents. So when our children are acting up, they are behaving in ways we don't expect them to behave. Please, it's not always that the child is stubborn. It's not always that the child is difficult. It's not always that the child is possessed. The child may be having some mental health challenges, and it's affecting him in the home. It's affecting his schoolwork, his school performance, as we have all heard. And there are things we two parents are guilty of. We'll talk about them next week. So please, let's be kind to our children. And when they start acting up, it's not about you. It's about that child. So let's focus on what we can do to make the child get the best and be the best that God has created him to be. And if we need help, let's get help. Help is available so that we can do the best we can for these children. God bless us all. And we'll come again your way next time. Same time next week at the living room on Equa Television. God bless you.